Good afternoon, my beautiful family. Thank you so much for coming back, watching my YouTube videos. I want to say a huge thank you to my returning viewers, and for the new viewers, if you haven't met me before, my name is Saima. I'm a nurse currently practicing in the UK. I'm trained from Pakistan. In today's video, we are going to talk about what are the responsibilities of a carer in the care home, and what kind of questions you can get in the interview. So if you're interested in this topic, please stay tuned, watch the video till the end. And if you haven't subscribed my channel yet, I provide information about UK nursing, lifestyle of a nurse in the UK, and then how you can become a nurse here in the UK. So if these topics interest you, consider subscribing. Thank you so much. So all today we are going to talk about interview questions for the healthcare assistants, for the senior carers in the UK for care home settings. All right. So there are loads of questions that a carer can be asked at the interview, but I will give you a few examples only. If you are interested, please watch the video till the end. So you can be asked about what is personal care. It's just a basic question, but you need to know how to answer this question. All right. Personal care means personal hygiene, bathing, showering, hairdressing, hair washing, everything that include in the personal hygiene, that is considered as personal care. Also includes shaving, oral care, and nail care, each and everything, bowel care. So that's called personal care. So you need to know how to answer that. The most important thing for you is to remain as natural as possible, and then don't let them feel that you are reading from a book or you are reading from somewhere. Okay, just use your common sense and be natural while answering these questions, and to excel the interview and pass the interview in your first go. So this is the first question we have: what is personal care? I've answered it for you, but this is just the random answer. You can do, maybe you can give an answer better than me. All right. So guys, you need to know what is a care home. Care home is a setting where all the senior citizens live there. If someone has complex needs, if someone is end of life, or if someone needs wound dressings, or they have impaired mobility, it doesn't mean that everybody who lives in a care home has dementia. All right, but there may be people, there may be citizens who have dementia. So you need to know what are their care needs. Okay, before you apply for the job, you need to know that what are kind of patients you are going to encounter there. All right, so you can be asked what is dementia. So you need to know what is dementia. Dementia is a generalized term that means that a person who is unable to think, remember, or make decisions for their best interest. Okay, so you are there to make a best decision for them. The people who cannot remember or think or make decision may have dementia. All right. You can also be asked what are the kinds of dementia, what are the types of dementia. There are different types of dementia: Alzheimer's dementia, dementia. There is Lewy body dementia. There is frontotemporal mixed dementia, vascular dementia, loads of kinds of dementia. So you need to be aware what kind of dementia your patient is having. As a carer assistant, it doesn't matter much, but just to familiarize yourself with these types of dementia, just to have a better understanding of your patient, and then this is the way you can help them better in their day-to-day activities. All right. You can also be asked what is safeguarding. So you need to know what is safeguarding. It shows with the name that safeguarding. Safeguarding means to protect someone from the harm, whether it's abuse, whether it's any kind of decision you make for the patient, like that is for the patient protection, that is for the patient safety. So that means safeguarding. Okay, that's how you're going to answer what is the meaning of the safeguarding: to protect someone from the harm or from inappropriate measures. All right. So that could be your next question in the interview, because you will be communicating with the patient, you will be communicating with your colleagues, with your managers, with your supervisor, each and everybody. So they can ask you what is communication. So you need to know communication. It's just simple, right? It is sharing the information with each other, or whether it's written or verbal or gestures. So you need to know how to answer this question. What is communication? Is just simple. Okay, just sharing of the information in different modes, whether it's written, as I said earlier. Okay. The next question can be, what is MCA? MCA means Mental Capacity Act. This is an act that was designed to protect people, to empower people who may lack capacity to make their own decision for their health and for their treatment. So you need to know how to answer MCA, the question if they ask you about what is MCA. So this is the Mental Capacity Act. So it gives the opportunity for the people like it's an act for the people who doesn't have capacity for themselves. So you are there to make decision on their behalf, or they can allocate anyone to make decision on their behalf. Next question can be what is abuse and types of abuse. So types of abuse, there are many. This can be sexual abuse, it can be physical, psychological, emotional abuse, so many kinds of abuse. So you need to know what are the types of abuse. It could be cultural abuse, it could be spiritual, financial, verbal abuse. All right, so you need to know the types of the abuse, guys, when you go there for the interview. These are the questions you can also ask you. What is confidentiality? So you need to know confidentiality means protecting someone's privacy and respecting their wishes. That is confidentiality. So you cannot share the information about them. GDPR, they can ask you about that one also, that why, if someone is calling you asking you about someone, you need to know who's that person. Is that person the next of kin? Can you share the information about the patient with them? So patient confidentiality is very, very important here in the UK. You cannot breach the law about the GDPR, sharing the information about any patient. If someone is asking, if you are not sure who's that person calling, all right, just make sure that you are giving the information to the right person. If that person is the next of kin, or if patient allows you to give information to that particular patient. All right, guys, consider this very, very, very important. If you are in the ward, the nurse is not there, or the nurse in charge is not there, and you get to answer that call, they ask you about a particular patient, don't give them information unless you are sure that you are talking to the right person, unless you are sure that you're talking to the next of kin of that particular patient. All right, this is very, very important. It's an extra tip for you. They can also ask you what is a CARE Act. CARE Act was is an act. It was passed in 2014. It means it helps to improve people's independence and well-being. So you need to know, guys, what is CARE Act. If you're not sure, just Google it and then find the information about the CARE Act, and you need to be confident in answering these questions. They can also ask you what is care plan. Care plan means is a plan for the care of the patient. It can be personal care, it can be mobility of the patient, can be pressure ulcers, skin checks, it can be sleeping pattern of the patient. Each and everything, all the details of the patient can be included in a care plan and in the record of care. If you find something suspicious about that patient, if you're not sure, just talk to your nurse or your nurse in charge. And then mostly nurses, they make the care plan, but if you have something to write, you can write on it as well. But be sure that you know what you're writing, what you are doing, and just discuss it with your nurse in charge or your nurse as well. All right, this is the care plan and the record of care. So you can record each and everything. You can record the personal belonging of the patient, you can record about the sleeping pattern of the patient, bowel habits of the patient, or how many times patient wheezes. In the care home, it's usually not that important that you need to know how many time patient wheezes, but if they have any kind of a condition that needs you to monitor their urination, then of course you can do that, but mostly it's not recommended, it's not necessary to do it in the care home. But bowel movements, yes, you need to. So these are the record of care. You need to know how to answer this question. And the care plans, as I said, nurses, they make the care plan. If you have something extraordinary, or if you have something to mention on it, you can do it as well. They can also ask you what are the 6 C's of the nursing or in a care. So you need to know what are the 6 C's: care, compassion, commitment, competence, communication, and courage. So these are the 6 C's of the nursing. Yeah, they can ask you about that. As I said earlier, they ask you about the communication, they can ask you about the 6 C's also. They can also ask you about what are the strengths of a carer. So a carer should have good communication skills, a carer should be compassionate, a carer should be courageous, and also should show empathy towards the patients, and also should be confident and competent in doing each and everything, right? So these are the strengths of the carers. Due to the condition going on, in COVID and all these things, communicable diseases, they can ask you about what is PPE, personal protective equipments, and they can also ask you about what are the things included in PPE. So it's gloves, gowns, face masks, goggles. So these are the things included in PPE. They can also ask you how to put them on and then how to take them off. So you need to know how to put on the PPEs. And always remember that the gloves are the first one to take off in the PPEs. All right, so the first thing you discard when you take off your PPE is your gloves. And also what are the things you need to wear first? Your gown. Your gown is the first one, isn't it? And then gloves last. So you put on the gloves last, but you remove them first. All right. So these were the question guide. They can ask you about they can ask you this question in the interview, but also in the beginning they can ask you about your work experience. They can ask you about do you have any questions to ask them. So just be prepared and always be natural, and try to answer this question in a confident way, and remain calm. Be on time. If your interview is scheduled for 10 o'clock, be ready at 9. If it's online, just make sure that you are online at least 10 minutes before the time. Thank you to them as well, and remain focused, content, and that's it. You can pass it. It's very easy. They don't ask very difficult questions. These are just the easy questions, but you just need to know how to answer them confidently. And that's it for today. If you like this video, please give it a big thumbs up, share it with your friends and family. I'll see you soon in the next video. Take care. Bye bye. If you like this video, please like it and consider subscribing if you haven't done so. Thank you. Bye bye.